Cornell University in Ithaca, New York is one of the top Ivy League schools in the United States. When students arrive at the beginning of the year, there is a scene that is played out at colleges across North America. Goodbye hugs from anxious parents. Students hurrying to get settled into their unique lifestyle on campus. The emotion of all this was heightened this past September at Cornell by the oppressive presence of a pandemic, according to one of those arriving students, Mariah Adege.
I think there was fear and excitement. I think we had been gone since March, so people were excited to be back and see their friends and things like that. But I think a lot of people at that time, including myself, thought that we would get sent home in 2 weeks and that there would be like some great outbreak and hundreds of students would get COVID. And gratefully that never happened, and our numbers stayed low throughout the semester.
The COVID numbers stayed low at Cornell because of an elaborate testing system set up by the university. Starting in September, undergraduate students were tested twice a week, graduate students once a week, the same for faculty and staff depending on how much time they spend on campus.
So we walk into the testing center, we use hand sanitizer, and we go up to one of the stations. So they're all at tables and they have the glass shields protecting us from the person proctoring the test. And then they hand us a swab, and we do 10-second circular motion on each nostril, and then we put it in a little vial and it's sent to the testing center. They don't contact you if it's negative, so you only would hear back if it's positive.
A special laboratory was set up at Cornell to handle 50,000 tests a week. In many states and provinces, these tests cost up to about $150 each. Through the economy of scale here, that cost has been reduced to about $15 a test. Samples are pooled and tested 5 at a time, with follow-up only for rare positive ones. Cornell epidemiologist Peter Fraser.
It reduces the number of tests that need to happen and the amount of chemical reagent, the volume of chemicals that need to be used in order to run the tests. So it really saves resources and allows us to run many more tests in a day, roughly 5 times more tests in a day, because we're doing pools of size 5 and not many pools test positive.
Now, even those $15 tests add up when you're doing 50,000 a week. Cornell will spend over $12 million on its testing system this year. Worth it, according to Cornell Provost Michael Kotlikoff, a molecular biologist who has studied the virus that causes COVID-19.
Well, SARS-CoV-2 is a virus that when people are infected, upwards to 80% of individuals either never show symptoms or very mild symptoms. So if you're only testing individuals that come in with symptoms, you're testing maybe 20% of the infected population. That means the rest of the population is walking around, they don't know they're infected, and they're transmitting the disease. The answer to that is to test everyone, and to test them frequently enough so that you can detect infection before it's transmitted.
Of course, testing is not the only thing Cornell does to fight the pandemic. Everyone wears a mask on campus, and the students are socially distanced in the libraries, study halls, and in the classrooms.
We sit 6 feet apart and we have assigned seats. And so I feel really safe with that as well. Even if someone were to test positive, I know a friend of mine who was in an in-person class, one of their classmates tested positive, and no one in the classroom got COVID, even though someone in the class had tested positive, because we're sitting far apart.
When a student tests positive, a rapid contact tracing operation is launched, and testing is redoubled.
So if someone in a classroom that's in an in-person classroom tests positive, we'll test everyone else in the classroom, we'll test the faculty, any TAs. If you're in a dorm, we'll test the whole dorm floor. And that allows us very quickly to understand whether there's been transmission and to get those people in isolation if there has been.
Infected students and their close contacts are directed to the Statler Hotel on campus, where they spend about 2 weeks in isolation.
Right now we're operating it as a facility for isolating people that are sick and for quarantining people that have been in close contact with people that are sick. And we have about 150 rooms here in the hotel. We can provide them, food, and we have nurses who are able to keep an eye on them. The health department does a contact trace where they find out where has the student been, whom have they come into contact with over the period when they might have been infectious. And those people are required to quarantine, which usually almost always happens in that same hotel.
When we started this, people talked about universities as sort of landlocked cruise ships where, people would be partying, everything would be going on, you're not going to stop it. And I think, we've demonstrated that students can behave responsibly.
I think there have definitely been some parties that led to outbursts. We've only had 2 so far this semester that led to clusters, but I think that people have been really good about not partying and kind of just doing their social events with less than 10 people and making sure that they're sticking to their pod and socializing with the people that they live with and maybe just a few other people outside of that.
There was bound to be a party that shattered all the good intentions, and it was bound to come from the Greek-lettered fraternities and sororities that are sprinkled around the campus. And that was what happened a few weeks ago with a party at a sorority that infected dozens of people.
We were able to detect it very quickly because we found cases through surveillance, through this regular testing. Then we were able to react to that extremely quickly, where we did contact tracing on the positive cases. We did adaptive testing where we tested all of the people in the fraternities and sororities that were affected. And that was really effective at controlling this cluster.
This testing system has made Cornell the envy of universities in the United States and Canada. It has reduced infections at Cornell by 2/3, from an average of 26 a week before implementation down to 8 today.
So I think there are a lot of lessons that can be learned from the Cornell experience.
Dr. Larissa Matukas teaches at the University of Toronto and is head of microbiology at St. Michael's Hospital. She says Canada has a long way to go on testing.
I think that we have always had the goal of driving the number of tests up and having that capacity available. But it really, at the end of the day, is really quite rudimentary about what we've actually been able to accomplish. And whilst we have done an incredible job, there are still a lot of gaps in our system that fall short of what the Cornell example actually provides us. So we should be having much more targeted testing. We should be identifying cases aggressively. We should be increasing the capacity within our laboratories.
Canada still has no plan for a Cornell-type testing system. Without that, you can't find the vast majority of infected people who have no symptoms and so don't normally show up to be tested. Unless asymptomatic infected cases are screened out, controlling an epidemic is almost impossible. Terence McKenna, CBC News, Toronto.